And that makes me sick of the week.
Sick of the week. We, of course, cannot know for sure someone's motivations, but I have my own opinions based on things that RFK Jr. has said. And it seems to me that he genuinely does not believe that infectious agents are a threat to what he classifies as quote unquote healthy people. And therefore, vaccines are a money grab that are making the pharmaceutical industry wealthy by creating unnecessary fear of disease or even making people sick so that the pharmaceutical companies can profit. I say this because in his book, The Real Anthony Fauci, he has a segment called Miasma versus Germ Theory, where he talks about how proponents of miasma believe that disease is caused when a body is damaged by poor nutrition or exposure to environmental toxins or stressors that allow otherwise harmless germs to cause problems. But that germ theory says that microscopic pathogens are what's to blame for disease, and therefore that's what should be attacked. And I need to point out a few things here. One, it's not like people who understand that bacteria and viruses and parasites cause disease don't think that an individual's health plays a part in their response to infections. Like, I don't know any virologist out there who's like, it's fine, you can eat nothing but pizza and never move, and it's just the germs that are making you feel bad. Two, also, importantly, his definition, that's not what miasma is. Miasma was a theory that existed before we began using microscopy to see pathogens. It theorized that all disease was caused by quote-unquote foul air that made you sick. What RFK Jr. is actually talking about in his book is called terrain theory, which is another germ theory denialism, and it's the idea that your lifestyle choices, like diet, amount of exercise, etc., influence a pathogen's ability to cause harm. He alluded to this belief a few times over history. He has said recently that it's almost impossible for a healthy person to die of infectious disease, or that the real reason that people were dying of AIDS during the height of the epidemic was due to the quote-unquote gay lifestyle and the use of party drug poppers. And this is all objectively wrong. Healthy people can get sick and die. Eating whole foods and a balanced diet and getting adequate exercise can certainly reduce your risk of severe illness with many infectious agents, but it doesn't eliminate it. Something like Ebola doesn't really care how fast you can run a mile. Not to mention, death is not the only outcome from disease. You know, how many stories have we had about otherwise healthy people being taken out by COVID or the flu or norovirus every year? The other thing that is really frustrating is that RFK Jr. himself uses examples of improved water and sanitation to uphold the idea of terrain theory, which again, he incorrectly calls miasma, as the reason that people get sick, not germs. He says in his book, the real heroes of public health were not the medical profession, but rather the engineers who brought us sewage treatment plants, railroads, roads, and highways for transporting food, electric refrigeration, and chlorinated water. And most of those things are inventions that were created to prevent or remove contamination by germs. So yes, actually, germs are the enemy. And this is really the crux of my issue with the focus of the MAHA movement. Because the idea that all disease is the result of how your choices influence your terrain, that implies that all of health is exclusively a choice. And if you get sick, then it's because you made bad choices. But there are so many things beyond individual control that we could be addressing that could improve people's health, like improving air quality and access to nutritious foods and access to safe spaces for physical activity, but that's not what's getting the focus. It's still just these small-scale issues like seed oils or food dyes, while simultaneously rolling back protections that would actually improve our quote-unquote terrain, like EPA rules on air pollutions or forever chemicals or ending farm-to-table school lunch subsidies. If you really wanted to improve people's so-called terrain, that would be great. I would have no problem with that, along with keeping access to safe and effective preventions like vaccines. But I don't see how allowing policies that work against environmental improvements while actively working to remove access to life-saving interventions helps to make America healthy again. And yeah, so I guess we'll just go ahead and make RFK Jr. our Sick of the Week once again, given that about 90% of this Q&A is dedicated to addressing things he said.